Vanakkam. Welcome to this course on classics in neuroscience. In the last set of videos, we looked at the neurological foundations of neuroimaging or neurological foundations of brain imaging. From this video onwards, we will look at the discipline of neurosurgery and how neurosurgery developed as a sub-speciality of surgery itself. In this series of videos, we will look at neurosurgery. We will focus on the seminal contributions of Harvey Cushing and Wilder Penfield and many other such stalwarts and legends to this field of neurosurgery. So, in this video, we will look at the origins of neurosurgery as a sub-speciality. Depending on how you look at it, it can be said that neurosurgery has a very long history or a very brief history. For example, there was this trepanning of the skull among Egyptians more than 2000 years ago as part of rituals, maybe to remove some evil spirits or something. For example, would that be considered neurosurgery? Because if you consider that as neurosurgery, then neurosurgery has a very long history, more than 2000 years old. But mostly for the purpose of this course, we consider neurosurgery that started developing after the evolution of general anesthesia, aseptic, antiseptic methods of 1840s and 1860s. So, the development of neurosurgery as a sub-discipline of surgery that happened after 1870 or 1880 is what we consider as the history of neurosurgery. So, essentially the history of neurosurgery is relatively young when compared with the history of medicine, for example. Two discoveries critical to the establishment of surgery itself. First is the advent of general anesthesia in the 1840s and the introduction of aseptic and antiseptic methods and techniques that happened in the 1860s. Because if not for these, it would be practically impossible to perform deep surgeries, especially surgeries such as the brain surgery. Later, in the 1860s and 1870s and later, there was this argument for localization of function within the cerebral cortex. This was from the work of Paul Broca and Carl Wernicke on speech production and speech perception. We have discussed this elsewhere. We have discussed this as part of other discussions in other videos and in other chapters. But remember, Paul Broca and Carl Wernicke, they suggested localization of speech generation and speech perception. Essentially, these areas that contributed critically to generation of speech and perception of speech came to be known as the Broca's area and the Wernicke's area. We know these things, we have studied this in the past. Of course, we have also briefly mentioned, I guess, or at least outlined the work of Fritz and Hitzig in Berlin. Fritz and Hitzig in the 1870s in Berlin essentially put a dog on the table and opened up its skull and started stimulating specific regions in the brain, in the cortex. And they found generation of movements when specific regions of the brain were activated, electrically stimulated. Among the first studies that performed electrical stimulation of the brain and showed a motor response. Of course, this was not exactly microstimulation, this was the 1870s. So, this must have been some sort of crude stimulation. By today's standards, this must have been some sort of relatively crude stimulation that must have been performed, but still it is a seminal contribution showing that there is a causal relationship between excitation of specific regions in the brain and movements generation. This work was later replicated by David Ferrier in England, who showed again in dogs, perhaps also showed in other animals, that there are these specific regions in the brain which when stimulated produce movements, motor acts. Also this led to the development of this idea or hypothesis that there was this motor strip which when excited or activated produces movements. There was this strip which contained neurons that when activated produces movements or at least twitches or at least some sort of movements in specific limbs or specific parts of the body. This discussion would be incomplete without a proper discussion of the contributions, seminal contributions of the British neurologist Hewlings-Jackson. He found that during epileptic seizures there was this series of movements or motor convulsions that he hypothesized to have a cerebral foci, because he saw this seizures spreading from one part of the body to the next adjacent part of the body. So he hypothesized that there is this strip or there is this area having neurons that is just anterior to the central sulcus. The region of the brain that is just anterior to the central sulcus has a causal relationship with movement generation, was the hypothesis that Hewlings-Jackson came up with in the 1880s and the 1890s. For 1880s and 1890s, this was a very profound observation, and this he observed, of course this he found from his observation and studies of patients of epilepsy, in which he had plenty of experience. So based on his abundance of experience and his studies, he came up with this idea that the region that is just anterior to the central sulcus has a causal role or plays a causal role in motor function. This region is now called as the primary motor cortex. We now know that this region that was earlier identified by Hewlings-Jackson is the M1 or the primary motor cortex. Of course, we have discussed in the previous set of videos about how Angelo Mosso in Italy observed in patients having head trauma, depending on the mental activation level, whether the patient was being spoken to or whether the patient is thinking or whether the patient is trying to perform mental arithmetic, depending on that, there was a change in the cerebral blood flow. Essentially, Mosso found that there was an increase in the flow of blood to the cerebral cortex if there was a greater amount of activity that was performed by the patient. Today, this is not surprising. If you tell this to a student of neuroscience, a first year student of neuroscience, she will be like, so yeah, I know there is more activation, there is more activity performed by the brain, so there is more blood flowing, what is the surprise? Because that was not obvious in the 1880s when Mosso came up with this, in the 1870s and 1880s when Mosso came up with this, it was not obvious. This observation was perhaps the first observation that causally related blood flow to mental activity. So, brain activity and blood flow being causally related was first shown or first observed and recorded by Mosso. This later went on to become the basis of several imaging techniques that we now use and that we have now identified and that we now take for granted. But in the 1880s this was not obvious. So, something to keep in mind. We have discussed these things as to more blood flow means more oxygen is flowing to the brain, and in the venous blood there is going to be a greater amount of carbon dioxide that is flowing out. As the amount of activation goes up, as the thinking amount goes up, or as the person is doing more tasks, mental tasks, the amount of oxygen consumed and the amount of carbon dioxide released increases. Again, this is obvious, but it was not obvious in the 1880s and the 1890s, but this was not the observation made by Angelo Mosso. He just said that more blood flows, but then when more blood flows, that also means that more oxygen is being carried, right. So, that is something that we are able to visualize. It was this principle that was used by others later to measure the amount of oxygen that was consumed, that later led the foundation for brain imaging. This is something that we have discussed in the previous set of videos on neuroimaging. Remember, please do revise that. Also, a major concern in the 1800s or until the 1800s that did not have a proper solution was brain tumors. Removal of brain tumors, the first proper neurosurgery for the removal of brain tumors was performed by William McEwen in 1879. This was pursued by other people, for example Bennett and Godley in 1884, who also performed more surgeries on the brain, essentially probably to remove tumors. Also, Victor Horsley was appointed as the surgeon for paralyzed and epileptic at Queen Square in London. This was a crucial milestone in the development of neurosurgery, because Victor Horsley and his contributions to the development of neurosurgery as a subdiscipline is perhaps unparalleled, or perhaps the first step that led to the beginning of neurosurgery as a subspecialty of surgery. So, Horsley performed, and with his surgeons they performed a whole series of surgeries. They performed about 43 surgeries to remove tumors, but there were about 10 deaths out of 43 operations. By today's standards, this is very poor performance, but I think for those days, for the good old days, I think this must have been fantastic performance, I guess. Later, Anthony Chibolt came up with this 3-volume handbook on this surgery, which is he called L'état actuel de la chirurgie nerveuse. Articles by 50 neurosurgeons, or 50 surgeons around the world who have also performed neurosurgery. It was a famous volume at that time. It was a famous book or famous set of records at that time, but somehow the results were not exactly so exciting. There was very limited improvement in actual health. Mortality was high. So, overall, essentially, if the positive is limited and if the negative is high, essentially that means that the results can be classified as overall borderline disappointing or actually fully disappointing. So, this is the story of how neurosurgery evolved as a discipline on its own. So, until 1900s, there were a few surgeries being performed with not much success, with considerably large amount of mortality, with limited improvements to actual health, serious dangerous surgeries these, seriously dangerous surgeries these. So, this field was perhaps waiting for a champion who could come up with rigorous methods to improve the health improvements and reduce the mortality. It was waiting for a champion, it was waiting for its own hero perhaps, and that hero we will see in the next set of videos. So, in this video we looked at the origins of neurosurgery as a sub-specialty of surgery. We looked at how localization of brain function and other such developments led to the development of neurosurgery as a discipline. Although there was brain tumor surgery being performed from as early as 1879, the appointment of Victor Horsley was a crucial step. And although even in early 1900s there were several surgeries being performed and people even wrote a 3-volume book, but still the results were indeed disappointing because mortality was high, but actual improvement in health was quite limited. So, this field of neurosurgery even as early as 1903 or early 1900s was still waiting for its hero. The field of neurosurgery was still waiting for its champion. The next set of videos will look at the champion of neurosurgery as a discipline. With this, we come to the end of this video. Thank you for your attention.